কই কি অবস্থা? হ্যাঁ ঠিক আছে, আপনি বসে ভেলা ভাই ভাই।
Before Bangladesh was formed, it was East Pakistan. Around that time, a missionary named John Addison came to this country. He traveled around the area making contacts, interacting with people, and sharing the love of Christ. He witnessed the deprivation, the physical, mental, and spiritual issues that people were dealing with. After touring the area, the idea of a hospital was born, a hospital that would benefit the people of the area.
LAM works in a number of different ways. Our main activity is in healthcare. We do a lot of primary healthcare work from village level, local level clinics, and then we have a hospital at the central site.
We aim to be accessible to all patients for treatment at LAM, whatever their age or gender or race or ability to pay or not pay.
I have around 75 nurses in this department. Among them, 52 are senior and junior nurses, and 23 are assistant nurses. Their work involves bedside care, health instruction to patients, giving out medicine, and following the doctor's orders, all done around the clock. LAM seeks to give the same degree of respect to the nursing directors and nurse manager as it does to all of the medical staff. An ongoing nursing program equips our staff to provide the best quality nursing care that LAM Project has to offer.
At LAM we have an apprentice model of training of most of our health staff, doctors, nurses, medical assistants.
The vision of the Human Resource Development Department is to make caring, competent workers increasingly the norm. In order to achieve that goal, we have values-based and skills-based curriculum.
The mission, vision, and values are a key emphasis for all the LAM staff. We are intent on teaching these principles to help staff learn and understand important concepts. For instance, it is important to us that each staff has the correct mental attitude when it comes to serving the poor. We always emphasize the value of respecting others, no matter who the trainees are, no matter what position they are in society. Villagers and doctors alike come here for training, and we exemplify equal respect toward all who come.
The postgraduate medical training at LAM was recently reviewed by the Bangladesh College of Physicians and Surgeons, and we've received accreditation for obstetrics, medicine and paediatrics, so that doctors who spend a year with us can have that time accredited towards their postgraduate exams.
We do a wide variety of general surgery at LAM. This goes into all the various subspecialties. What surprised me when I came here was the number of reconstructive operations that I do. Cleft lips, cleft palates, and burn contractures.
যারা First, we try to take it from the patient's family, and many times their blood group matches. We have also noticed that they often don't want to give blood to a patient because they're scared. They actually get excited when they're finished giving blood because they realize that someone was helped by their donation. We do a lot of work in this lab, especially clinical diagnostic work, like hematology, microbiology, blood chemistry, and such.
We have 5 chaplains, 3 ladies and 2 men. Our goal is that they will visit every hospital admission and explain to the patient that this is a Christian hospital and what it means to be a Christian hospital.
When we sit beside a mother, for instance, and comfort her, she naturally warms up and begins to talk. I listen to her intently and try and understand what she is saying. I encourage her, support her, and let her open up. Our job is to make her understand that God loves her so that the pain she battles with will diminish.
I always tell them, we can give you treatment, but we cannot heal you. There is only one who can do that, our Creator. Only He can make you well because He is our Maker. These are the kind of things I say to the patients.
One of the LAM vision statements is we are a people who will live biblically, work locally, contribute nationally, and influence globally. And I think research is a good example of how that works out in practice. Over the years, as research has come up on the programme at LAM, we've gone from organising a programme through to having a committee, and right now we've actually got a whole department working towards that.
We are conducting many types of research at LAM. For example, HIV prevalence, patient satisfaction with clinical care, and the quality of obstetric services.
We want to understand what affects health choices. There may be social or financial reasons why patients seek care too late or not at all.
For a poor person, the problem is money and lack thereof. Normally you pay for quality service. Here, a poor patient is easily admitted into the hospital and does not have to pay first before being treated. When a patient comes into the hospital, their economic status is assessed. A Poor Fund committee establishes the amount that will be covered by subsidies at the end of their stay.
And it's one of our proudest boasts that we've never turned a patient away because they couldn't afford to pay.
At LAM, we want to give high-quality medical care to patients who come through the door, but we want to go beyond that, to actually address their fears, to look at the issues behind their health issues. There's chaplains who can come alongside and give time in amongst the busyness of the wards. We also coordinate with the community health department as much as we can in terms of patients going back into the community and having information about where they've come from in the first place.
When we start community health and development work in a new area, first we go to a village and sit with them and find out their hopes for the future. We meet with various groups such as children, women, men, and old people. We find out their needs and what resources are available in their local area. Then we meet with them again and make plans. Actually, when we begin working in the village health volunteers go to homes in the area and teach hygiene and nutrition. This has had a good impact on their overall health. They also encourage people to go to the clinics and get proper checkups by the qualified individuals we have trained.
Women involved in LAM savings and loan groups decided to invest some of their pooled funds into the health services. This kind of partnership transforms communities and individuals to bring about change.
We really believe that's how we can live biblically here, because improving health for the community is very much living biblically and on God's heart.
The things that we need prayer for are that we would remain very much in the centre of God's will in this part of Bangladesh, that we listen to Him and move forward in the work that He's doing here rather than thinking our own thoughts before Him.